Botswana. Et viennent de s'ajouter Togo et Ouganda, et j'arrête la liste. Merci. Je passe donc la parole au Burundi.
Merci, Monsieur le Président, de me passer la parole. Comme mes prédécesseurs, le Burundi se félicite de la disponibilité des documents du secrétariat. Le Burundi invite l'OMS à accompagner les pays membres pour qu'il y ait dans nos différents pays des plans nationaux d'adaptation au changement climatique. Le Burundi demande aussi à la Direction générale de l'OMS d'inviter les grands pollueurs de ce monde à diminuer la production des gaz à effet de serre conformément aux accords de Paris. Le Burundi soutient la stratégie régionale proposée et demande à l'Assemblée ici présente de l'adopter moyennant l'intégration des contributions qui ont été données. Je vous remercie.
Merci le Burundi. Je passe la parole à la Namibie.
Thank you, Mr. Chair. Namibia also welcomes the regional strategy for the management of environmental determinants of human health with the following comments. Chair, the proposed regional strategy is key to accelerate the implementation of the Libreville Declaration. Therefore, it would make sense and it would add value to also report on progress on the implementation of the declaration. Nevertheless, Mr. Chair, we are pleased to see the synergy between the regional strategy and the Libreville Declaration, and in particular that by 2019 all member states should have country task team in place, completed situation analysis and needs assessment, and develop national plans of joint action. Chair, many countries have developed substantial experience in the implementation of the Libreville Declaration, and it would be pleasing to know that their experience and lessons learned are factored into the development of this regional strategy. We are informed that in the African region, 23% of premature deaths are attributable to unhealthy environments. An up-to-date regional profile showing the proportional breakdown in terms of principal source, risk factors, and mortality may be useful, especially in the wake of the need to prioritize in resource-constrained settings. Chair, we also wish to emphasize the need to recognize the complexity of the environmental determinants of health, including the contribution of diverse sectors and multifaceted risk factors. Hence, we also advocate that the One Health approach as a principle should be amplified in the strategy. While we do not have specific amendments to the strategy for proposal, we suggest that the targets be closely linked to the objectives, Chair. For example, the objective to strengthen capacity for integrated monitoring and surveillance of environmental determinants of health and ecosystems integrity should have clear outputs that will contribute towards achieving this objective, and importantly, to ensure that by 2019 that all member states have the necessary capacity to monitor and conduct surveillance of determinants of health. I thank you, Mr. Chair.
Bien. Kenya, you have the floor.
Thank you, Chair. Kenya is pleased to take the floor and wishes to thank the Secretariat for developing this strategy, which highlights the key interventions member states can implement to address the environmental determinants of human health with their populations. Kenya has made significant strides in tackling environmental determinants of human health. Mr. Chair, notably, Kenya has launched the Environmental Sanitation and Hygiene Policy and the Environmental Sanitation and Hygiene Strategic Framework to operationalize implementation of measures towards management of health risks, factors associated with water, sanitation, hygiene, food, general and clinical wastes, vectors and vermin, airborne pollution, and occupational hazards. In addition, the National Healthcare Waste Management Strategic Plan and the Occupational Safety and Health Act 2017 are also in place. Mr. Chair, currently we are in the process of developing a draft bill on the environmental health and sanitation. To specifically address the environmental pollution attributable to health sector, Kenya is piloting 10 medical waste microwaves and shredders for management of medical care waste. Additionally, the ministry has also installed 5 medical waste autoclaves in 5 high-volume hospitals and continues to explore and adopt the non-ban technologies in waste treatment. Mr. Chair, despite this robust legislation, we continue to face challenges related to technical expertise, inadequate surveillance, the weak enforcement of existing legislation, and lack of sufficient data on environment determinants and their direct effect on human health within our population. We commend the work WHO has done in developing, disseminating, and reviewing the relevant monitoring and reporting tools in order to streamline appropriate reporting, monitoring, and evaluation. To bridge the resource gaps, aggressive resource mobilization, and increased focus on partnership and collaboration should be strengthened in order to continue stimulating in-country resource mobilization efforts. Continuous strengthening of efforts to promote and adopt best available technologies and best environmental practices should also be promoted. We therefore call upon WHO and member states to develop regulations and guidelines to operationalize the international declarations and domestic legislation on environmental and health. In addition, we request WHO Secretariat to assist member states to identify and to develop the requisite skills and capacities that are required to tackle environmental health issues effectively. I thank you, Mr. Chairman.
Thank you, Kenya. Le Togo a la parole.
Merci, Monsieur le Président. Je voudrais tout d'abord vous adresser les félicitations du professeur Moustapha Midjiawa, le ministre de la Santé et de la Protection sociale, qui n'a pas pu faire le déplacement ici. Le Togo voudrait également féliciter le directeur général pour son élection et féliciter la directrice régionale pour les efforts dans la gestion des problèmes de santé dans la région africaine. Je voudrais, au nom du gouvernement du Togo, présenter les condoléances au gouvernement et au peuple de Sierra Leone. Monsieur le Président, remercie et félicite le secrétariat pour les documents techniques. À cet effet, la santé humaine est fortement influencée par les déterminants environnementaux. La pollution de l'air, l'eau, l'hygiène, l'assainissement du milieu constituent des facteurs contributifs aux maladies non transmissibles et aux maladies transmissibles. Les mutations des écosystèmes induites par la pression des activités humaines concourent au changement du profil épidémiologique des maladies. C'est à juste titre que la stratégie régionale proposée se fonde sur la déclaration de Libreville, l'engagement de Luanda et les objectifs du développement durable, à travers une approche intégrant les actions sur les déterminants environnementaux de la santé humaine. S'agissant des mesures proposées dans la stratégie régionale, tout en adhérant aux enjeux et aux défis qui les sous-tendent, nous saluons la pertinence et sollicitons davantage de soutien technique dans la réduction surtout des risques. Monsieur le Président, nous voudrons également, en référence au document qui est à notre disposition, souligner qu'il y a un point au niveau du paragraphe 26. Au niveau du point 26, le paragraphe 1, la dernière ligne, au lieu de la gestion antivectorielle intégrée, écrire plutôt la lutte antivectorielle intégrée. Le Togo approuve la stratégie régionale. Je vous remercie, Monsieur le Président.
Merci. Je crois que le secrétariat a pris bonne note de la modification. Botswana, you have the floor, please.
Thank you very much, Mr. Chairman. Botswana acknowledges the progress of the report on regional strategy for the management of environmental determinants of health and of human health in the African region 2017-2021. I'll also like to note the milestones and targets achieved by member states that are articulated in paragraph 8, and probably just to share what Botswana has been doing. Botswana aligns itself and supports the strategy as it facilitates the implementation of the Libreville Declaration, which we are a signatory to. As part of the implementation of that declaration, a situational analysis needs assessment was conducted in 2013. Furthermore, a national plan of joint action NPJA 2013 to 2018 was developed. In line with the implementation of the NPJA, Botswana embarked on the development of a national environmental health policy with the support of World Health Organization. The policy will facilitate the country to better manage environmental risks that impact on human health. Botswana has also developed a very comprehensive chemicals management bill and a draft healthcare waste management policy. Other interventions include capacity building on water safety planning for all sectors dealing in water and health-wise training, which seeks to improve occupational health workers and health facilities. But for me, really, in this document, I think there's two guidelines that are very key, which are in this document on page 4, and it's country ownership and leadership, its integration, and I think it is because for many times health really has been a ministry that is in the periphery, and this really puts the Ministry of Health at the center of development. I think it's about time that in country we realize that the issues pertaining to health are not just for health ministries to tackle, but they have to be inclusive and included comprehensively in the national development plans. And therefore it means we ought to be taking the lead. We have to be busybodies as ministers of health. That's really what this document says. We ought to be talking to infrastructure, to water, to energy, to environment, to education, etc., including local government. We are at the core of each and every development, because if we don't, it will come at the back of it all when we are now having to tackle issues that could have been tackled as a priority beforehand. So we welcome this development, and therefore we support the strategy. We set the milestones and targets as it shall guide in the building of appropriate capacity and place ministries of health at the center, at the core of the developmental agendas of member countries. Thank you very much, Chair.
Thank you, Botswana. Uganda, you have the floor.
Thank you, Chair. Ladies and gentlemen, Uganda thanks the Secretariat for the regional strategy. Preventable diseases due to poor sanitation and water-related diseases are consuming a significant proportion of our health budgets in our region. Environmental changes are driving the evolving epidemiological pattern of many diseases and even their vectors. In addition, the region has become a key destination for dumping of hazardous waste from markets external to the region. All this calls for renewed efforts to collaborate amongst ourselves to manage our environment in pursuit of improved population health. Air pollution is a transboundary hazard that affects the global atmosphere and contributes to climate change. Drug-resistant pathogens, including growing number of superbugs, are thriving in a poorly managed environment. Tackling environmental determinants will require that collaboration with sectors outside health, and this is quite challenging in our countries of our region. Yet many of the investments in water, sanitation, environment are outside the traditional mandates of the health sector. So it means that we need to get in a health in all policies with the paradigm must be prioritized in all member states if environmental determinants are to be optimally handled. I thank you all.
Okay, thank you, Uganda. I think it's the end of interventions of the different members of delegation. Le secrétariat aurait-il quelque chose à ajouter? Docteur Bakayoko, bien, notre expert, vous avez la parole.
Thank you very much, Mr. Chair. We sincerely thank the member state for this invaluable contribution and the great interest in this paper. So their comments were very pertinent, and that demonstrates the relevance of managing environmental determinants of health in the African regions. So key aspects that were highlighted in member state comments include the need to perform environmental risk assessment and mapping. So this is an initiative we have already embarked on in the regions. So far in 10 countries, we have done vulnerability assessment and mapping, and we would like to really extend this to other member states. And also integration and inter-country collaborations. I think this is also a key component. So country-to-country cooperation is key, particularly given the transboundary nature of some of the issues. There is also an important aspect which includes our regional economic communities, who will play an important role on influencing development sector on addressing these environmental determinants. So, and there was also a proposal to develop a roadmap of monitoring and evaluation of this strategy, which is very well welcomed. An important comment from Burkina Faso was how should we go about the intersectoral collaboration? The issue is, in some countries who start putting in place country task team, these country task team are hosted by the Minister of Health or co-coordinated by the Minister of Environment. But in countries where it holds at Prime Minister level, like Gabon, we have really concrete, tangible results. I think member states will see what is the best way, but what we recommend is to put this coordination at a higher level. An important issue is extractive industries. This is a very important issue, and particularly if you consider today small-scale gold mining, which is a serious issue devastating our environment, our fertile lands, and also our health issues. I think for this, we propose to really reinforce what we call environmental and health impact assessment, because most of the time countries implement projects before doing a proper environmental health impact assessment. I think this is an important aspect, and we will consider it. So, progress on Libreville Declaration has been also evaluated. So the evaluation was done in 2014 because we were planning to have the third interministerial conference. But because of the Ebola outbreak, this conference was not held, and then we need now to update the declaration. Otherwise, we have a comprehensive assessment of the Libreville Declaration, which report is available on our websites. Regulation on international or multilateral environment agreements, MEAs. We know that our member states are signatory of most of the international agreements. Rotterdam Convention, Stockholm Conventions, Basel Conventions, Minamata Conventions recently, but the key issue is to implement these conventions. And we really think that there is a need for paradigm shift, and that can be addressed within the context of this strategy. Because the focal person of these conventions are in the Ministry of Environment most of the time. So there is a need of intersectoral collaboration as recommended in the documents. And to also highlight few intersectoral collaboration at regional level, we know within the Libreville Declaration context, there is really a dynamic collaboration with the UNEP or the UNEP environment. So I think they were invited by the regional director, and they are here in the room. So we are working closely together. And this year they are having the United Nations Environmental Assembly in December that will focus also on pollution. I'm mentioning that because if we work with, there are some areas that the health sector may not have a comparative advantage, but that can be better supported if we work with other sectors. But what we can do is really to use consolidated evidence on the impact on health and influence the other sectors. There is also a joint coalition on health and environment and climate change that includes WHO, UNEP, and World Meteorological Organizations. There is also the military declaration that was signed in Marrakesh in margin of COP22, and that was also a good platform. So we have a partnership which is being developed between UNEP and WHO to address air pollution and raise awareness and capacity building within the context of the joint task team. And there is an important issue that this same declaration, the UNEP proposed to send it to the ministerial conference, the interministerial meeting for environment, which is the equivalent of RC, that will be held, and they want to send the same strategy that it can be implemented by the Minister of Environment. Because we used to do that for when WHO, the member state approved the climate change and health strategy, AMSEN also approved it. And I would like to give the floor to my regional director for additional comments and other member of the secretariat.
Oui, prendre la parole. UNEP, you want to take the floor? Please, you have the floor. Not. Bon, je considère donc que personne ne veut plus prendre la parole. Ok,
Je m'excuse.
Okay.
Chair, okay.
Yeah.
I was suggesting that it might be good to see if UNEP would like to say anything. We know that, and my colleague said that UNEP are here. I think if they have any suggestions to make, one of the issues that has been brought up particularly has been how, not that it's good to have this intersectoral collaboration, but perhaps they might give some ideas. How do they see it working in countries? What do they think might be the best mechanisms? Or any other comment that they might have to make. Thank you. Otherwise, personally, I don't have anything to add on top of what the colleague has said.
Right.
Thank you very much, Regional Director, and thank you, Chair, for giving me this opportunity. My name is David Ombisi from the Regional Office for Africa of United Nations Environment Program, or UN Environment, as we call it nowadays, based in Nairobi. And I'm here representing the Regional Director, Ms. Juliet Biao, who could not make it to be with us at this important conference. Quickly, just to emphasize what my colleague Margaret has already said, from the UNEP side, we've been working very closely with the Regional Office for Africa of WHO, really to implement the Libreville Declaration and also the Luanda Commitment, and ensure that we support member states right from the development of their assessments and also in the development of the joint plans of action. Further to that, we are in the process of organizing the third interministerial conference on health and environment, basically bringing together Your Excellencies, Honorable Ministers of Health, and also bringing together Ministers of Environment. This, I think, was mentioned by the Regional Director yesterday. We are yet to agree on the specific dates and venue, but we'll be working towards that and we'll be sharing that information with you. At the global level, UNEP headquarters is also working closely with the WHO headquarters to develop this partnership whereby we'll be able to work very closely on a number of issues. And as you have mentioned through your contributions today on the issue of prioritization, we are already looking at the issue of air pollution as a priority, but of course we'll also be looking at other sectors, including water, land pollution, and so forth. And the issue of chemicals, again, was mentioned very strongly here this morning. Now, towards that agenda, we have the United Nations Environment Assembly, which is the topmost decision-making body of UNEP, and this will be taking place in Nairobi from the 4th to the 6th of December. And the focus for this particular meeting will be on pollution, whereby we are looking at how do we reach or how do we make efforts to have a pollution-free planet. As most of you have already contributed, there are quite a number of environmental determinants that, of course, have a big impact on our human health. And therefore, one of these determinants is pollution, be it air pollution. As you know, it's a silent killer that is killing millions of our populations in various parts of the world, particularly so in Africa. We have issues of chemicals pollution, land pollution, water pollution. These are some of the things that the ministers of environment globally will be coming together in Nairobi during UNEA 3 to see how do we address this. And it's not only ministers of environment, but we also be inviting other stakeholders, the private sector, and other sectoral ministers also to be joining us during this particular conference in Nairobi. Further to that, of course, as I mentioned, we have the coalition where we are working closely with WHO and also WMO on issues related to environment, health, and climate change. And of course, those who were in Marrakesh last year, there was a ministerial declaration that was adopted at that particular meeting, whereby the three organizations, together with other stakeholders, were invited to work together to be able to address the issues of environment, health, and climate change. So we are working on different fronts, both at the global level, but also at the regional level. And we have the joint task team, as my colleague Margaret mentioned, that will be pushing these efforts forward in the coming few days and in the coming months to make sure that we are able to implement some of the recommendations that will be coming out of this meeting, and also some of the recommendations that came from the meeting of the environment ministers, which took place in June in Libreville. So I'd like to stop there and to thank you very much. And myself and my colleague will be here throughout this week to be able to listen to you and be able to take on board some of the recommendations that you'll be making here, which we can always also share with the environment colleagues and to make sure that both environment and health ministers or sectors work closely towards addressing the challenges that we continue to face. Thank you very much.
Oh, merci, distingués délégués. Pouvons-nous considérer que le comité régional est disposé à adopter la stratégie régionale contenue dans le document AFR-RC 67/6 intitulé Stratégie régionale pour l'action sur les déterminants environnementaux de la santé humaine dans la région africaine sur la période 2017-2021 en tenant compte des divers amendements proposés. Il en est ainsi décidé, la stratégie régionale est adoptée. Distingués délégués, certains observateurs ont souhaité s'exprimer également sur ce point. Aussi voudrais-je inviter Dr Jeremia Mwangi à prendre la parole pour son intervention au nom de la Fédération mondiale du cœur.
Honorable Chair, distinguished delegates, the World Heart Federation welcomes the committee's report and its recognition of the urgent need to monitor and address the environmental determinants of health. We commend the inclusion of multi-sectoral task teams, sustainable financing, and robust surveillance systems as core elements of the strategy. To ensure that environmental determinants such as climate change are addressed in a comprehensive and integrated way. We further commend its reference to the impact of the environment on non-communicable diseases, or NCDs. Globally, 8.2 million deaths from NCDs each year are linked to environmental causes. Environmental risk factors, such as air pollution and tobacco smoke, also account for 31% of cardiovascular diseases, or CVDs, while stroke and ischemic heart disease are the two conditions most linked to environmental causes. Additionally, environmental risk factors such as rapid urbanization, poor hygiene, and household overcrowding increase the risk of rheumatic fever and rheumatic heart disease in the region. Tackling NCDs and protecting the environment are among the defining challenges of this century, and both have the potential to reverse the public health and development gains achieved in recent decades. However, governments can take great strides to improve human health and the environment by forging partnerships and implementing cost-effective interventions with co-benefit solutions. These include creating sustainable health food systems, reducing air pollution, and investment in infrastructure and security that support active transport and free open-air exercise. To address CVDs and NCDs, and to support implementation of the regional strategy and Libreville Declaration, we make the following recommendations. 1. Include NCD representatives in multi-sectoral country task teams. 2. Increase resources allocated to health system strengthening at the primary healthcare level. Strengthening primary care can both improve health outcomes and provide a basis for integrated health and environment surveillance systems. And 3. Pursue climate change funding opportunities for interventions that improve both health and the environment. The health sector currently receives less than 1.5% of climate change funding. However, there is a compelling case to invest in co-benefit interventions. We reiterate our support to Member States in their implementation of the regional strategy for the management of environmental determinants of health. Thank you.
Merci pour ce support de la Fédération mondiale du cœur. Distingués délégués, je voudrais maintenant que nous passions à un autre point inscrit à l'ordre du jour. C'est l'examen du point 10, intitulé Stratégie mondiale du secteur de la santé contre les infections sexuellement transmissibles sur la période 2016-2021, cadre de mise en œuvre dans la région africaine. Il s'agit du document AFR-RC 67/7. Je voudrais passer la parole à Dr Felicitas Zawera, directrice du groupe organique santé familiale et reproductive, pour qu'elle nous présente ce document.
Thank you very much, Mr. Chair. Honorable Ministers, Heads of Delegation, on behalf of the Secretariat, I have the privilege to introduce the document AFR/RC67/7 entitled The Global Health Sector Strategy on Sexually Transmitted Infections 2016 to 2021 Implementation Framework for the African Region. As you can see, the starting point of this strategy is already behind us. The strategy was adopted during the penultimate regional World Health Assembly, but as a region, we had not come down to come up with an implementation framework. Hence, we are bringing the implementation framework to you. The document provides programmatic and policy guidance to member states to facilitate implementation of the global strategy on sexually transmitted infections. It describes actions and roles that you as member states need to take in order to fast-track STI prevention and treatment interventions in the region in order to end the STI epidemic. The actions proposed include prioritizing STI prevention, expanding STI testing services using diversified approaches, and scaling up treatment by adopting innovative service delivery models. While HIV is a sexually transmitted infection, as you are aware, there was already a strategy separately for HIV which was discussed at the last regional committee. So this document focuses on the following sexually transmitted infections: chlamydia, gonorrhea, syphilis, trichomoniasis, herpes simplex type 2, and human papillomavirus. The document gives you the global picture of the burden of disease that these STIs contribute to. But as mentioned, the African region is particularly affected with a high prevalence of these infections. The total number of new cases of these four curable and even the uncurable ones was estimated at 63 million in 2012, representing 18% of the global incidence. These STIs have a profound impact on the health and lives of the population worldwide. This includes the high risk of fetal and neonatal morbidity and deaths due to syphilis in pregnancy, the risk of cervical cancer due to HPV infection, the risk of infertility mainly due to gonorrhea and chlamydia infection, as well as the facilitation of the sexual transmission of HIV. One of the key issues related to STIs is inadequate information. Data on STIs in the region are constrained by inconsistent reporting within and even between member states. National and subnational data are often lacking or inadequate. STI surveillance programs are weak, making it difficult to plan for focused action and prioritize allocation of resources. Other issues include the inadequate implementation of preventive interventions, the inadequate access to STI services, in particular for those who are most at risk, the limitations in case management, inadequate financing and research. When we are going to talk about acute antibiotic resistance, sexually transmitted infections fall into that category because a lot of people start treatment, they feel well, they stop, and the next time they have the same sexually transmitted infection, the bugs have learned and they are not going to be able to treat those. So when we talk about AMR, don't think of only TBs and the others, including sexually transmitted infections. We have a problem there. In terms of our recommendations to address these challenges, we are looking for opportunities for integration into the other programs in order to reduce the missed opportunities. As a committee, we are requesting, as your secretariat, for you to look seriously at how we can have rational surveillance systems in order to meet the defined targets. The regional committee is therefore invited to examine and adopt this regional implementation framework. I thank you, Chair.
Merci, Dr. Felicitas. Je voudrais maintenant donner la parole aux distingués délégués pour leurs commentaires ou observations. Nous voyons le Cameroun, le Niger, le Sénégal, le Kenya, Côte d'Ivoire, Tanzanie, Zambie, Angola, Gabon. Je pense que c'est bon. Algérie, Burkina Faso, Congo. J'arrive pas à voir Ghana. Côte d'Ivoire, Côte d'Ivoire, Sao Tomé, Nigeria, Botswana, Afrique du Sud, quasiment tout le monde. Je voudrais vous demander d'être bref parce que je suis supposé vous faire manger à 12h30, sauf si vous ne voulez pas déjeuner aujourd'hui. Ou alors que vous allez réduire votre temps de déjeuner parce que la reprise sera dans tous les cas à 14h30. Donc soyez bref. Je ne voudrais pas commencer par le Cameroun, mais c'est le Cameroun qui a montré en premier le macaron. Cameroun, vous avez la parole.
Thank you, Chair. We want to congratulate the Regional Committee for this document, which is well written. We want to say that Cameroon recognizes the negative effect of sexually transmitted infections. We know that our health structure is pyramidal, and for several decades we've developed documents, norms, and directives that address sexually transmitted infections across all the health pyramid. We are very aware of the fact that there are two types of STIs, those of the upper genital tract and those of the lower genital tract. We handle both of them. We know that the latter usually themselves are not very aggressive, or what they do is to alter the pH of the genital tract, allowing for the aggressive ones to ascend to touch the vital organs that are reproductive. And our approach to eliminate STIs tallies with strategies that have just been elaborated in this document that we all read. And so, beginning from the lowest ebb of our health structures, we collect data on STIs. And we are putting high impact interventions that are spread across the health pyramid so that at the basic level, STIs can be managed with some kind of seriousness. In our common antenatal package, serology for syphilis and the treatment of syphilis are part of this package. In our country, we put in affordable generic medications that can manage STIs at all levels of the health pyramid. We are trying to advance the agenda of the HPV vaccine with scale-up that is going on. And we are now introducing HPV in our API program to accelerate progress on how to manage STIs. The screening and treatment is part of our performance-based financing that is being looked upon in the whole country. And also, we have included the screening and treatment of STIs in our universal health cost package. That is what we do. That tallies with what this recommendation has been making. Thank you very much.
Thank you, Cameroun. Le Niger, vous avez la parole.
Merci, Monsieur le Président. Les infections sexuellement transmissibles continuent à n'en point douter à être un problème de santé publique et leurs conséquences influent gravement sur la qualité de la vie des populations. L'approche de mise en œuvre de la stratégie mondiale du secteur de la santé contre les infections sexuellement transmissibles 2016-2021 sur la base des leçons tirées de la période 2006-2015 est à nos yeux encore plus pertinente et réalisable quant à Le Niger s'inscrit pleinement dans cette optique. D'ores et déjà, les actions que nous sommes en train de mettre en œuvre cadrent bien avec stratégie. Il s'agit entre autres de la prise en compte des interventions à haut impact, dont notamment la prévention du cancer du col dû au papillomavirus qui a commencé dans quelques districts sanitaires échantillons. Il reste la phase de la généralisation qui, cependant, n'est pas sans implication financière importante. L'autre défi majeur à relever est celui de la recherche sur la résistance aux antimicrobiens liés à ces infections. Le Niger approuve donc ce cadre défini de mise en œuvre de cette stratégie du secteur de la santé contre les infections sexuellement transmissibles dans la région africaine et encourage l'OMS à appuyer les pays à sa réalisation. Je vous remercie.
Merci. Le Niger, le Sénégal a la parole.
Merci beaucoup, Monsieur le Président. Donc, je voudrais, à la suite de ceux qui m'ont précédé, faire remarquer que des avancées notables ont été notées dans la riposte contre les IST, mais que la persistance à un niveau élevé du risque de stérilité, de mortalité néonatale et de cancer de col de l'utérus rappelle l'urgence de combler certains gaps. Donc, ainsi, le Sénégal a fait quelques contributions pour l'amélioration de ce cadre de mise en œuvre, notamment au niveau des interventions proposées à haut impact, au niveau de la rubrique 23, du sous-chapitre 23, renforcer la surveillance. Nous pensons qu'il manque cruellement de données et que la pertinence des schémas recommandés depuis de nombreuses années est loin d'être garantie. Des recherches opérationnelles sur l'état des lieux en matière de résistance devraient permettre de réviser les recommandations en cours ou de les actualiser. Donc il est important de faire un état des lieux sur la sensibilité des différents germes. Au niveau de la ligne 27, qui concerne le renforcement de la prise en charge des cas en utilisant les lignes directrices actualisées, nous pensons qu'il existe beaucoup de gaps à combler pour une prise en charge effective des infections à papillomavirus, notamment l'évaluation de la prévalence et le profil des différents virus circulants, surtout parmi les populations clés, l'introduction du vaccin dans les populations MSM selon les résultats des études de prévalence, l'offre de prise en charge des infections à HPV, notamment des condylomes qui restent encore très spécialisés et très faibles dans nos pays. Surtout que rendre accessible la prise en charge des infections HPV passe par la délégation des tâches, par une formation du nombre critique de paramédicaux sur les techniques simples et accessibles. Pour tout cela, nous pensons que la prise en charge des végétations est le vrai parent pauvre dans un contexte africain, car sa prise en charge est assurée par des spécialistes peu accessibles. Donc il faut capaciter une masse critique de paramédicaux, ce qui devrait nettement améliorer l'offre de soins. Le Sénégal invite alors les États membres à adopter ce cadre de mise en œuvre de la région africaine de la stratégie mondiale du secteur de la santé contre les infections sexuellement transmissibles 2016-2021. Je vous remercie de m'avoir donné la parole. Merci.
Merci, Sénégal. Kenya, you have the floor.
Thank you, Chairperson. First, I would like to thank WHO Secretariat for this wonderful report. Kenya recognizes the rising burden of sexually transmitted infections as a public health concern. There is an urgent need to identify a strategy to combat the rising disease burden if we are to realize the SDG by 2030 or to achieve the goal of eliminating STIs as a public health threat by 2030. In Kenya, according to the Kenya AIDS Indicator Survey 2012, 6.2% of women and 1.5% of men reported genital discharge, while 3.8% of women and 1.6% of men reported symptoms of genital ulcer disease, while the prevalence of HIV among persons reporting symptoms of STIs was 12.5% compared to 5.6% in the general population. Mr. Chair, we note challenges that countries experience in the management of the STIs programs, including that of inadequate data, mainly because the STI surveillance systems are very weak. We also note that inadequate access to services due to structural barriers to health services, resorting to inequitable access to STI services. Mr. Chairman, we also note that in many countries, STI programs continue to be managed as vertical programs and not integrated in the general healthcare delivery systems. Therefore, Kenya welcomes the regional implementation framework of the Global Strategy on Sexually Transmitted Infections 2016-2021 and would like to request the WHO Secretariat to encourage member states to prioritize STI programs and ensure adequate allocation of resources to ensure that STI response is fast-tracked. There is urgent need to integrate the surveillance systems of STIs as well as prioritize resources to build and strengthen the surveillance and reporting systems. The STI prevention and care should be integrated into national health programs and or to HIV/AIDS program in order to seize the opportunity for funding and to ensure better use of financial resources. Lastly, we request the WHO Secretariat and partners to support member states to strengthen the national laboratory capacities to monitor antimicrobial resistance, including that to STI. I thank you.
Thank you. Kenya, Côte d'Ivoire, vous avez la parole.
Merci, Monsieur le Président. La Côte d'Ivoire félicite le secrétariat pour le rapport. En Côte d'Ivoire, le IST constitue encore un fardeau avec environ 21,3 cas pour 100 000 habitants. Et face à cette situation, le pays a mis en place diverses actions, notamment l'élaboration d'indicateurs pour les IST afin de mieux définir le profil des populations touchées, l'intégration de la prévention des infections sexuellement transmissibles aux thématiques VIH, santé de la reproduction, planning familial, et la lutte contre les violences basées sur le genre, l'élaboration d'un plan complet des préservatifs afin d'améliorer l'utilisation des préservatifs des gels lubrifiants, des mesures de protection des mineurs, des minorités sexuelles, de même qu'une loi VIH, la révision de l'algorithme de traitement de l'infection conformément aux nouvelles lignes 2016 et la prise en charge des IST, la participation du pays au programme mondial de surveillance de l'OMS avec un élargissement de la surveillance antimicrobienne au laboratoire et surtout l'initiative de la phase pilote de la vaccination contre le papillomavirus avec l'intégration de ce vaccin dans le PEV. Les défis demeurent cependant et portent sur les questions de viabilité, du financement et surtout de l'innovation pour accélérer les progrès en matière de lutte contre les infections. La Côte d'Ivoire réaffirme son adhésion à la stratégie mondiale de lutte contre les infections sexuellement transmissibles 2016-2021 et s'engage à sa mise en œuvre. La Côte d'Ivoire soutient le projet et demande aux États membres de l'adopter. Merci, Monsieur le Président, pour la parole donnée.
Merci, la Côte d'Ivoire. Distingué délégué, ce point est très important. Et vous vous êtes inscrit au nombre de 18 interventions. Je voudrais que vous acceptiez que nous suspendions nos travaux parce qu'il y a également notre événement parallèle qui est prévu entre 12h30 et 14h30. Je voudrais vous souhaiter un bon appétit et vous demander d'être là à 14h30 précise, sachant que le premier intervenant à la reprise sera la Tanzanie. Je vous remercie. La séance est... Bon, je voudrais rappeler que l'événement parallèle, c'est cet événement sur le mectisant this side event on celebration of 30 years of the Mectizen donation program will take place in the Kalala Room. Je ne connais pas où se trouve le Kalala Room, mais je crois que vous allez vous retrouver. Ok, la séance est suspendue. Merci. Le secrétariat aurait encore d'autres annonces. Secrétariat, vous avez la parole.
Good morning, dear guests and honorable ministers. Just to remind you to fill out the form, the return form which was provided in your file. Then just to remind you to fill out the form and to leave it on the table. One colleague will come to pick it up, then to schedule your travel and your return. Thank you very much.
Merci. Cette fois-ci, c'est définitif. Bon appétit.
Ça doit être préparé à l'avance.